We're called the weaker sex. But when it comes to longevity and surviving illness and coping with trauma, you know which sex outlives the other. In the Philippines and worldwide, women outlive men by more than 5 years on the average. Pinays have achieved better control of our reproductive health also, as shown by the decline of fertility rates from 4.1 children in 1993 to 2.7 children in 2017. Health facility deliveries in our country have more than tripled, nearly tripled from 28% in 1993 to 78% in 2017. So why bother with an International Day of Action for Women's Health? Women make up 70% of healthcare workers globally because women are the backbone of healthcare within the family, within our communities, and in our country. Public spending for women's health benefits not just women, but the entire population. Women shouldn't be dying because of pregnancy and childbirth. But in the Philippines, the latest statistic is 121 maternal deaths per 100,000 births. If that doesn't sound high, Vietnam only has 43, Thailand has 37, Malaysia 29 per 100,000 maternal deaths, Philippines 121 per 100,000. Filipino children also have a greater chance of dying within the first 5 years. Per 1,000 children under 5, the data shows 27.3 deaths per 100,000, per 1,000. In Vietnam, it's only 19.9 per 1,000. And in Thailand, it's 9 deaths per 1,000. In Malaysia, only 8.6. The Philippines, 27.3. The national fertility rate may have gone down from 4.1 to 2.7 children for women. But in households that struggle the most with finances and lack of opportunities, meaning in our poorest households, women still average 4.3%. If the Philippines lagged behind our Asian neighbors before COVID-19 struck, imagine how it is now. The World Health Organization found significant disruptions in health services in 90% of low and middle income countries. What happened? Sexual and reproductive health and rights were deprioritized. Equipment and services, health services for sexual and reproductive health were diverted to fulfill other needs. And providers were forced to suspend some sexual and reproductive health services that were not classified as essential. Sounds like what happened to us here. According to the Center for Reproductive Rights Asia, before the pandemic, it was estimated that 2,400 women and girls die every year in the Philippines from preventable causes related to pregnancy and childbirth. There is a high probability that preventable deaths would only increase with diminished health system resources, especially with less of an access to reproductive health services, family planning services. And also we have a problem with transportation facilities, with access to hospitals. In fact, there are cases where women have died because they were not admitted to hospitals. So the COVID response must take into account the specific needs of women's reproductive health and rights. Soraya Abay, former executive director of the United Nations Population Fund, said, "We cannot confront the massive challenges of poverty, hunger, disease, and environmental destruction unless we address issues of population and reproductive health." Hillary Clinton said, "We cannot make progress on gender equality or broader human development without safeguarding women's reproductive health and rights." In the midst of the pandemic, May 28 reminds us that for the good of the country as a whole, advocates for women's rights must continue prodding the national government and our local governments to implement the Magna Carta of Women provisions on comprehensive health services. We must ensure that women's health remains a government priority with availability and access to essential sexual and reproductive health services being part of government COVID-19 response. Women are the backbone of our health systems. We need women's health. Good morning.